Okay, well, it's 12:05. If you're here for the UC Center Sacramento Speaker Series, you're in the right place. And this week, we're once again privileged to join together with the UC Consortium on the Developmental Science of Adolescence. As we do nearly every week during the year, we bring you this speaker series with the aim of making policy-relevant evidence and science produced on the 10 campuses of the University of California accessible to policymakers and to the community. Through our speaker series, special panels and workshops, policy briefs, and other means, UCCS builds bridges between students, researchers, and California state policymakers. And if you want to find out more, our website is uccs.ucdavis.edu. The subject today is sex trafficking of youth. And to introduce our panel, we're glad to have on hand once again, Paul Hastings, who is a UC Davis professor of psychology, the director of the Healthy Relationships, Emotions, and Development Laboratory. He's former chair of psychology at UC Davis, former interim dean of the Graduate School of Education, and he remains, through the years, a very good friend of UCCS, and we've been privileged to partner with him and his group on many other programs. So with no further ado, I'll turn it over to Professor Hastings to give additional introductions. Paul.
Thank you for that kind introduction, Richard. I'd like to start by thanking the UC Center Sacramento, including you, Richard, as well as your team members, Cindy, Brooke, Sandra, and all of their colleagues for the continued outstanding efforts that you've been going through to bring us these important platforms for sharing knowledge and the particular challenges that you've overcome in order for us to be able to continue doing so within the pandemic and quarantine conditions. And thank you as well to everyone who's joining us online today for this live webinar. This webinar, with the support of the UC Center Sacramento, is the fifth in a series of panel presentations being given by members of the UC Consortium on the Developmental Science of Adolescence. The consortium was founded 6 years ago and has benefited from the continuing support of the UC Office of the President through the multi-campus research programs and initiatives mechanism. The consortium brings together faculty and graduate students in psychology, public health, education, human development, medicine, and other fields from 5 of the UC campuses in order to share their expertise in pursuing, teaching, and applying an integrative multidisciplinary approach to understanding adolescent development. Today, I'm very happy to be introducing Drs. Jody Quas and Corey Rood. Dr. Jody Quas obtained her PhD in developmental psychology from UC Davis and completed a postdoctoral fellowship at UC Berkeley and is now a professor of psychological science in the School of Social Ecology at UC Irvine. In addition to her research on stress, emotion, memory, and physiology, Dr. Quas is an expert on child maltreatment, children's eyewitness testimony, and the consequences of legal involvement on child victims and child witnesses. She has received awards for her work from the American Psychological Association, the Society for Child and Family Policy and Practice, and as a Fulbright specialist in 2018, Dr. Quas worked in Asuncion, Paraguay to train government, medical, and NGO workers and to educate public audiences on the systemic effects of child maltreatment and methods to identify and protect victimized children. Dr. Corey Rood obtained his MD from the Oregon Health and Science University, completed a residency in pediatrics at the University of New Mexico Hospital, and then did a fellowship in child abuse pediatrics at the Ohio State Hospital. Dr. Rood is now an assistant professor of pediatrics at the UC Irvine School of Medicine and the medical director of child abuse pediatrics at UCI Medical Center and Miller's Children's and Women's Hospital. He works directly with child victims of maltreatment and neglect and conducts research on domestic and international human trafficking of sexually exploited children and youth. Dr. Quas and Dr. Rood are planning to save a good amount of time for an engaged discussion. And so I'm going to ask you to save your questions for the end of their presentation. We have a hard stop at 1 today, so they will move through their presentation with enough time to give you ample time to pose your questions and engage in discussion. And in order to maximize that amount of time, I'm going to wrap up my introduction at this point and ask you to join me in welcoming Dr. Jody Quas to the microphone. Jody?
All right, thank you so much. This is really exciting and I'm delighted to be here with everyone, albeit remotely or virtually, to talk about some of the innovative efforts, but also some of the remaining challenges regarding identification and intervention for youth victims of sex trafficking. And I guess I want to begin by stressing the magnitude of this problem, not only across the globe, but also within kind of across the United States and in local communities. Now, media attention and public awareness oftentimes focuses on international victims of trafficking, especially those who have been smuggled against their will across borders to be trafficked. But domestic trafficking, or trafficking within the states, is an equally significant problems, where youth and adults are trafficked both within their own communities, but also they move county to county where they're exploited. Kind of sometimes in California, what we have is we have a lot of youth moving from rural to urban settings for trafficking purposes. Now, just kind of before I go on to talk about the way the science can help, I also wanted to make the point that for those of you who are wondering, the pandemic and national and statewide stay-at-home orders haven't actually stopped trafficking. Girls and some boys continue to be identified on the streets of Los Angeles, Orange, and other counties across our state, being exploited by both professional traffickers, but also opportunistic traffickers. Thus, there really is this continued need for significant attention to be directed towards preventing this heinous crime from occurring, protecting the youth who have been victimized, and prosecuting the perpetrators who exploit vulnerable youth. Now, efforts in the past decade have really ramped up across the country, especially in California, in regard to identifying and intervening on behalf of victims. And as a way of sort of starting, I want to say that, there have been some really great partnerships that have been formed within counties, both with governmental and also private agencies, to try to communicate and collaborate in ways that most effectively serve victims. And kind of a shout out to Orange County. Orange County's really been on the forefront of the formation of these partnerships. The Orange County Human Task Force has really brought together multiple organizations and agencies to address the county's needs in terms of kind of helping the victims in the county. Agencies include law enforcement and social service teams. The courts are involved, both attorneys and judges. We have multiple nonprofits, and even more recently, some healthcare and educational agencies, all of whom are communicating regularly, both about the efforts in general in the county, but also the efforts for specific victims. Now, what's been really key to this task force and others is the provision of support and resources so that they can pursue these efforts in the most effective manner possible. So at the start, kind of let me just stress kind of not only a shout out to what a great job I think these organizations and groups are doing, but also really the need for continued support so that they can continue doing this outstanding job. Now, even though they really are doing an outstanding job and making tremendous progress, there remains kind of really important ongoing challenges. And what I want to do is I'm going to talk about one of these, and then I'm going to turn it over to Dr. Rood to talk about another one. But what I've done is I really kind of focused on these challenges because these are really kind of the ways that we want to keep moving forward and improving what we're doing to identify and intervene on behalf of victims. Now, one of these challenges kind of the one that focuses on victim questioning, really focuses on the front end of victim protection, namely that of identifying victims, figuring out how best to talk to victims to find out what's happened, if anything, so that they can be directed towards the appropriate services and prosecution can occur. The other involves really maximizing the benefits for victims to help them once they've been identified. Now, my own work for the past several decades has focused on issues that are very relevant to this first challenge. And so what I want to do is step back for a moment and talk a little bit about the work and how scientific research can help address this challenge. So this challenge of how do we identify victims of sex trafficking really kind of is related to this broad domain of how do we question suspected victims of child maltreatment more broadly. And this particular question actually has been the focus of a great deal of scientific research for the past several decades. Psychologists have systematically and very comprehensively evaluated forensic interviewing approaches for use with child victims and witnesses. We have very well-established protocols now that can be used with victims to elicit disclosures, to elicit complete and accurate responses, and protocols that reduce errors and the potential for false reports. And so the evidence surrounding these best practices is so strong and so well established that there's now been a push to apply those same types of questioning strategies to youth involved in other legal settings, including youth involved in immigration. And they're required to be questioned regularly about victimization, violence exposure, and crime. They're also especially reluctant. Thus, these strategies are really valuable across different legal contexts. But in order to look and see whether those same types of strategies may be effective with trafficking victims, I think it's really important to look at the science and how the work that's developed these strategies has been conducted. So most of the work, scientific work on these evidence-based guidelines for interviewing have been conducted on children through young adolescents. So most of the work has tested different interviewing strategies for preschoolers through about 12, maybe 14-year-olds. And the work is most readily applicable to victims who have already been identified. Now, when you look at something like child sex abuse, the most common way that it's identified is via children's own disclosure. Perhaps it's intentional, sometimes it's unintentional, but that really cues others into kind of knowing that there's something going on with a child. And once that's known, then children are generally routed to highly trained forensic specialists. And these specialists have been kind of trained in the use of protocols. They follow these very well-established guidelines to interview the children. And these interviews lead to very high levels of accurate disclosures and reduce errors. Because of this, legal cases can go forward with a high degree of confidence that what children is saying is accurate and complete. So in Orange County, again, just to kind of make a shout out to Orange County where I'm located, this is typically done via our child abuse assessment team or CAST, and they consistently follow these best practice protocols, and their interviews are oftentimes believed to be, and really some of the best that we see when we look across the literature. Now, when you step back though, and you think, okay, well, maybe we could take those same protocols and those same guidelines and just apply them to trafficked youth, we have to kind of evaluate whether trafficked youth really look the same as other victims, or whether there's something different about trafficking victims. And it turns out there are a number of key differences that may affect both how willing they are to talk to people and also then, how best we should question them. So to give you a couple of examples, unlike the work on child sex abuse and other types of child maltreatment victims, most trafficked youth are in their adolescent years, usually ages 13 to 17 or 18 when they're actually identified by the authorities. Unlike child victims, whose disclosures oftentimes prompt the investigation, trafficking victims rarely disclose on their own. Instead, they're oftentimes identified either because they're arrested due to delinquency or criminal activity, prostitution, or gang activity, or they go to a medical facility because they have a sexually transmitted disease. So they're not openly telling someone that's leading to an investigation. Once they are identified, they're rarely routed to the child forensic interviewing specialist. Instead, they're typically questioned by law enforcement. If their victim status is unknown, they may be questioned as a suspect. They can be arrested, they can be interrogated. Only then it may be revealed that they're also victims of trafficking. And again, they're most often questioned by police. And sometimes, even if law enforcement knows that they're victims, they may well be detained still for their own protection. And so none of this overlaps with the experiences of child victims when they are routed to these forensic interviewing specialists, nor do these types of experiences foster kind of support or trust in the authorities, even though the authorities are ultimately there to help the trafficking victims. Now, given these differences in victim type and their potential experiences when they're questioned, what we've done in our scientific research is we've been actually studying whether or not kind of the actual questioning of these two groups of victims or suspected victims is actually similar. And if so, then what we can start to do is, okay, if the questioning similar, are the responses similar? Or do we need to change our protocols somewhat to find better ways of eliciting information from trafficking victims? So kind of to preview the scientific work that we've done that's been funded both by the National Science Foundation, but also by UCI's Initiative to End Family Violence, when we focused on whether questioning approaches are similar, the answer is, well, they really don't look that similar. Then when we focused on, well, what about trafficking victims? Are they really considered victims? And the answer again is not really. So let me kind of explain to you a little bit about the science and what it shows and where we might need to make some modifications to these interviewing protocols. So turning to kind of this first interview, this first topic, and this focuses on interview questions. What do these look like? Well, what we've been able to do is we've been able to obtain transcripts of both trial questioning, but also interview questioning of child abuse victims, compare those to trafficking victims to identify some of the similarities and differences. To show you first kind of what child sex abuse interviews look like, when we've gone in and we've actually looked at all the types of questions, and you can break them up into different kind of the way questions are phrased, what you can see is that about 8 and 51%, so 59% of the questions are really these more open-ended invitations, where what we're trying to do is get children to provide information. Those are generally followed up with what are called closed-ended questions that happen about 41% of the time. And these are yes/no questions that are more focused on specific details. These open-ended questions, these 59% of the questions, are actually believed to be the better kinds of questions that are asked. They allow children to say what they know, and they're less likely to lead children into agreeing or kind of just answering a question because they believe that that's what an interviewer wants to hear. When we've looked at the same types of questions and we look at them in interviews with adolescents who are suspected of having been trafficked, we see some differences almost immediately. So first of all, when we look at those open-ended questions, the tell me what happened or tell me more about questions, rather than the kind of 59% we see in the child sex abuse interviews, what we see in the trafficking interviews is this is about 39%. Thus, it's a much lower rate of these open-ended questions. And these are the questions asked now here by law enforcement rather than kind of the child abuse specialists. So they're asking far fewer of these open-ended questions and a much greater percent or proportion of the closed-ended questions. And one of the challenges with that is that these closed-ended questions, even if they're focused on specific details, when there's high proportions, those can actually undermine the credibility, the perceived credibility of a child. Thus, the higher the percentage of closed-ended questions, the more likely it is that a victim's credibility may be questioned. When we looked at these different questions types, though, it may be that maybe those questions are necessary with trafficking victims. Maybe they're not as forthcoming. So what we then did is we looked at, well, how are youth responding? And when we looked at the child sex abuse rate, we do find, consistent with lots of other literature, that when you ask children these open-ended prompts, children have generally low unresponsiveness. Children have disclosed or told someone previously. They oftentimes know why they're in an interview. And they will oftentimes, though not always, provide some substantive or legally relevant, useful information about their experiences, even to open-ended questions. Their also unresponsiveness when you ask these yes/no questions tends to be very low. When we do the same kind of comparison with adolescent victims, what we find is that they're also fairly responsive when you ask these open-ended questions, but their responses aren't helpful. And so anyone who's interacted with a teen knows that teens can do this all the time. They kind of give you an answer, but not really what you're looking for. And these adolescent trafficking victims are doing the same thing. So their open-ended questions responses really suggest that they're being evasive. They're answering but not being helpful. They also tend to be more unresponsive to these closed-ended questions. So their responses really, both the questions and their responses, suggest that we may need to start modifying or at least tweaking some of our best practice protocols to find better ways of getting them to tell us the information that we need to figure out how best to direct services for them and how best to prosecute those who commit this crime. What we've also done with these transcripts is we've examined, well, what types of information are being reported in these trials. And so we actually been collecting transcripts across the entire state of criminal trials between 2013 and 2018 that involved charges of trafficking or pandering. And again, then what we can do is we've been looking at, well, what types of questions are asked in trials? What are victims saying? And then what we've also been able to do is to really look at some other aspects of these cases to figure out what's happening. Because if we can understand what's happening and what makes these cases unique, we can better direct law enforcement and legal personnel to help them pursue these cases. And these are pretty preliminary findings, but what we're already seeing is that in these trials, most of the questions, again, are closed-ended. They're also temporally just disjointed. And by this, what I mean is when victims are being asked questions, the questions aren't following a logical sequence. So they may be asking about one event, then going back in time, then going forward. And because the questions are closed-ended, victims are simply answering. And what happens is that makes it very difficult for the trier of fact or the jury to follow along and gain a comprehensive understanding of the timeline and sequence of an event. That type of temporally disjointed question then undermines victim credibility and makes it more difficult for the prosecution to prove a case, even sometimes when there's other evidence. What's also been striking in these cases is that the victim's behavior is really featured very prominently. Victims are quite regularly described as complicit. And their, what you might think of as bad behavior, their delinquent criminal activity, drug use, running away, that's regularly discussed as well. What's not discussed, though, are the reasons why victims might be complicit or the reasons why they might engage in this delinquent and criminal activity. So less is said oftentimes about the victim's background that may have led to them feeling as though being trafficked is one of the only ways that they can survive. Nor are the victims kind of the adolescent development, kind of in how adolescents can be manipulated into behaving in particular ways. That's rarely mentioned as well. Thus, what it appears is that the victims are really being highlighted as not being children or youth, but their behaviors being featured much more kind of prominently than it is in other types of sex abuse cases. Now, what this work is suggesting is that we, even though I think we're doing a really good job in terms of increasing public awareness and increasing our efforts across our county and others to identify victims, there really are some important steps that remain. And so one of them that we really see as important is because these trafficking victims continue to be questioned and treated differently in legal settings than other child victims and adolescent victims. There really is this continued need for training in awareness of adolescent vulnerabilities, of the risk factors for trafficking, and how those may contribute to victim behavior. There's also this continued need to test what specific questioning approaches are most effective with trafficking victims to elicit clear and complete disclosures rather than these evasive responses that we're seeing. And finally, there's really, I think, a clear need for comprehensive training on kind of not only trafficking risks, but also victim characteristics and vulnerabilities and questioning tactics. And this training is really crucial for a wide range of first responders. Trafficking victims may encounter these first responders in medical settings. They may encounter them in law enforcement, in educational settings. And so all of these potential first responders need to be aware of the risks, the vulnerabilities, and what types of information they need to gather initially to figure out how best to direct services so that victims can be identified and interventions can be targeted most appropriately. So let me, I guess, stop there and turn it over to my colleague, Dr. Rood, who's going to turn to kind of the second challenge and go on from there and talk about some of the other efforts that he and others in the county are doing. Okay, thank you.
Perfect. Well, thank you, Dr. Quas. So I will take over and bring us to our second challenge that we are facing as we work with survivors, victims and survivors of trafficking, specifically as we identify them. Our biggest issue once they've been identified is really making sure they're receiving the resources that they need to be successful survivors. I want to go back and reiterate some of our numbers here in California quickly. We are the leading state in the country as it pertains to our reports to the National Human Trafficking Hotline. This is run by the Polaris Project, and they have tracked statistics since 2007. We have identified over 18,000 survivors of human trafficking here in California through these calls, and most of these calls are from the public. But we have the numbers as a state. We are doing a fantastic job at having organized task forces to address these numbers of survivors. As we've looked at those numbers, and they've interviewed the survivors, they've found that average age of entrance into trafficking, in other words, the first time that that individual was exploited or trafficked, what age were they when that happened? And as you can see, in 2018, the National Human Trafficking Hotline built this graph, and it shows that the average age for first-time sex trafficking is 18 years of age, meaning that over 45% of first-time victims are under the age of 18. Okay, we have a staggering number of children, young children, 0 to 8 years of age, who were identified across the country. These are national statistics, but you can see that we are dealing with a large population of youth and minors. So understanding how to identify them and speak to them appropriately is crucial, but then we need to also understand that these young persons have incredible health maintenance and mental health needs because of this trauma. There have been multiple statistics over the past decade. So we here in the United States passed our Trafficking Victims Protection Act in 2000, and that's when our studies really began. Currently, as recently as 2016, we really have better data to show that the average age for sex trafficking really sits around 18 to 19 years of age for that first event. And this is solidified by large numbers of interviews with survivors. It wasn't until about 2014 that a pillar study was published by a group called Global Centurion, and they are a legal group that works with legislation at the national level. They interviewed about 100 female adult survivors of sex trafficking, and they asked them all about their health history and their health exposure while they were being trafficked. As you can see here, some of the information I pulled from that article to highlight, they have increased rates of physical assaults, murder, and HIV. They are being victimized 8 to 13 times per day on average, but some are victimized as high as 50 times a day. They have higher rates of suicidality and substance abuse and addiction and overdose compared to their non-trafficked cohort population they were compared to. Following this, with this study, they asked a very particularly particularly enlightening question with regards to how many of you as survivors sought medical attention while you were being trafficked. Remarkably, 88% of them stated they had sought medical attention while being trafficked. 65% of these women said that they went in alone to get birth control or birth control counseling. A follow-up study done by a medical group in 2016, Dr. Chisholm Straker and her colleagues asked labor and sex trafficking survivors across all ages whether or not they had sought medical attention while they were being trafficked. And 65% of them said yes. You can see the institutions that they went to, mostly the emergency rooms, but they also went into dental, and we even have pediatricians seeing these survivors. What are they coming in for, and what sort of injuries or medical presentations do they have? As we've spoken and interviewed survivors in these studies, what we found is that the leading reason is because of physical trauma. They are physically assaulted by their traffickers or by buyers or by other victims. So they come in with assault wounds and assault injuries. With regards to their reproductive health, they are presenting because of sexual assaults. As you saw, the average number of sexual assaults per day on average is 8 to 13. Sexually transmitted infection concerns, these STDs, concerns for pregnancy, concerns for abortion options, and they can have genital trauma, and both males and female victims report reproductive health concerns. And then there's mental health. This is the leading leading issue that we are dealing with as a healthcare profession are the mental health consequences of the significant trauma, really a complex trauma that these survivors are reporting, primarily post-traumatic stress and all of its symptoms, along with suicidality and drug and alcohol addiction. So why is this important? It's important because as we look at trafficking survivors, we know that they have significant medical needs. Okay, just based on their exposure and their victimization, there have been multiple publications recently in both the American Academy of Pediatrics textbooks, as well as others, showing that these survivors, especially minors, need a physical exam, they need STD testing and potentially medications to prevent HIV and pregnancy. They need full head-to-toe assessments, including what other nutritional deficits or vaccines they are lacking. Are they behind on their screenings and their development? It is crucial that these victims are at least offered the opportunity to discuss with a healthcare professional their concerns about their bodies, their concerns about their mental health, and to receive options that are available from our state-of-the-art healthcare facilities across our country. But what we are finding is that this isn't happening. They're not being identified. So as Dr. Quas stated, we are not identifying them on the front end, either because we are questioning them incorrectly or our first responders aren't recognizing who they are. By the time they get to the medical facility, most of our medical facilities aren't trained in how to recognize victims of human trafficking, either sex or labor. And our medical professionals, they tell us this. Our survivors, they tell us this. After they've gone to seek medical attention, they were never asked about violence or victimization. When it comes to human trafficking task forces, and I speak from a broad experience on task forces. I was on the state task force for Ohio, recently on the state task force for Utah, and I'm currently on the task force here in Orange County. Task forces across the country don't have medical representation classically on their task forces. They are very investigative minded, or services partnering with NGOs in the community for housing and education and legal needs. But medical has often been overlooked until recently. So without medical direction, many task forces don't recognize that these victims need medical services immediately. They're not recognizing sex trafficking victims as rape victims. And so they're not following the same response as rape victims are receiving in our community. In other words, they're not taking these recently sexually victimized youth and minors to a medical facility immediately for a rape kit or for rape care. And they aren't getting the medications they need to prevent things like HIV and pregnancy and other STDs. Another barrier we are facing is how do we fund the medical professionals and the medical facilities who are seeing these victims? We might think that, oh, well, if they're victims of human trafficking, then they should be eligible from state Medi-Cal. That's not always the case. They may not be a resident of this state, and they may not be remaining in this state for long. They may be from another state, and the goal is to return them to that state and that jurisdiction. They may have a private insurance and still be living with their parents, and so they're under their parents' insurance, whether that's Kaiser or another PPO or HMO. We do know that state law for California does protect us, the medical facilities, from billing victims themselves, which is very protective. And so most places like CAST and other children's advocacy centers turn to Medi-Cal, they turn to private insurances, and they turn to law enforcement, who pays for a lot of the sex abuse and sexual assault exams. But when law enforcement doesn't recognize these victims as rape victims or sexual assault victims, or even sex trafficking victims, and isn't bringing them in, then law enforcement's not paying. So our challenge is as it pertains to these victims and their medical and mental health needs, they should be receiving the same standard of care and best practices that all of our maltreated children are receiving. They are victims of maltreatment. They are victims of a crime and should be offered the same medical standards of care and mental health treatments that their peers are also receiving. And this is crucial because their trauma is complex and their trauma is very difficult to parse through as a medical provider. We can only do that when they are presenting to our medical facilities or we are recognizing them as medical professionals. As we do so, there are often barriers with training medical providers when they hear that how are we going to be paid and compensated for this work. Money is not the most important to most providers, but I can tell you that money does keep the lights on in most medical facilities. And they do want to know at the end of the day how this is going to be covered. And most of us don't have a good, solid answer at this moment. So with that, I guess we open up to questions.
Oh, great. Thank you so much.